Hello students, I am Dr. Manish Soni and today we will be discussing an integrated session on STI and fungal infections. With me there is Dr. Sonu.
Hi friends. So we'll start up without wasting time with first very high yield topics, and one of them is genital ulcer disease.
Now genital ulcer disease is something where a lot of time clinical questions are asked और जब भी क्वेश्चन शुरू होता है तो वो शुरू कुछ इस तरीके से होता है कि history of contact or a genital ulcer was seen. So whenever you see genital ulcer or history of contact then you can be very sure that this is a question from STI. And जब भी आपको genital ulcer दिखता है तो सबसे पहली चीज जो आपको देखनी है वो ये देखनी है कि ये genital ulcer painful है या painless है. तो अगर वो पेनफुल है तो आपकी जो डिफरेंशियल डायग्नोसिस है वो रिस्ट्रिक्ट हो जाती है, वो कम हो जाती है बिकॉज देयर आर फ्यू कंडीशंस व्हिच कॉज पेनफुल जेनिटल अल्सर्स एंड दीज टू कंडीशंस आर शैंक्रोइड एंड हर्पीज जेनिटलिस. ठीक है, तो सबसे पहले क्या करना है, आपने पहले क्वेश्चन देखना है. क्वेश्चन में लिखा होगा हिस्ट्री ऑफ कॉन्टैक्ट या फिर जेनिटल अल्सर. फिर आपको उस क्वेश्चन में ढूंढना है कहीं पर पेन लिखा है या नहीं लिखा है. अगर पेन लिखा है तो आपके दिमाग में दो चीजें आनी चाहिए, एक शैंक्रोइड और एक हर्पीज जेनिटलिस, क्योंकि दोनों में ही पेनफुल जेनिटल अल्सर्स होते हैं. एक चीज और आपको याद रखनी है कि जेनिटल अल्सर्स के साथ यू शुड ऑलवेज एग्जामिन द इंग्वाइनल लिम्फ नोड्स. सो इफ यू आर एग्जामिनिंग द इंग्वाइनल लिम्फ नोड्स एंड इफ यू फाइंड दैट दे आर पेनफुल एंड सुपुरेटिव, then it is suggestive of chancroid, and if it is painful and non-suppurative then it is suggestive of herpes. Now I would request Dr. Sonu to tell about the causative organism for this condition.
Yeah, thank you, sir. So guys, regarding the chancroid, everybody knows Haemophilus ducreyi, this particular organism, which is a gram-negative cocobacillus, okay, which is a gram-negative cocobacillus. This particular one does this chancroid. And as sir and me both tells up the fashion in which we learn this, the do cry, that is painful. Fine. The person rota hai, that is do cry, ya dukh raha hai, that is painful. So this is chancroid done by this Haemophilus ducreyi. Okay. Another important thing like which they relate up nowadays in integrated one is that they will ask up that is it bipolar stain or not. So guys, this particular one is what? Bipolar stain. And as you know, what is bipolar stain? It is having a safety pin appearance. Okay. This organism, Haemophilus ducreyi, it is stained in such a fashion that the poles are stained, in between remains unstained. So it gives the appearance of what? Safety pin. Okay. So this particular one is regarding that. And whenever anybody talks about Haemophilus, immediately what should come in your mind? Chocolate agar. Okay. What should come in your mind? Chocolate agar. Haemophilus loves to grow on chocolate agar. And in this particular one, you need to know that you have to add up a factor X also. And factor X is an extra factor, that is hemin, which you add up and it stimulates the growth of Haemophilus ducreyi. So that also can be asked. In the question, they can give you all this history. They can give you the image. And along with that, they can write up the organism needs an extra boost of factor X. So which organism you are talking about? So that is Haemophilus ducreyi. Right?
So सर ने बहुत ही स्पेशल एक अपीयरेंस बताया, सेफ्टी पिन अपीयरेंस. और सर कई बार क्या होता है, मैक्रोफेजेस इनको एनगल्फ कर लेते हैं और उसके बाद आपको उस मैक्रोफेज के अंदर बहुत सारे बाइपोलर स्टेन्ड बैक्टीरिया दिखते हैं. तो इसका एक स्पेसिफिक नाम भी होता है, वी कॉल इट डोनोवैन बॉडीज. और कई बार स्टूडेंट्स कंफ्यूज हो जाते हैं डोनोवैन और एक और होती है एलडी बॉडीज के बीच में.
सर वो डोनोवेनोसिस, this particular condition.
So one is chancroid and the second differential for painful genital ulcers is herpes genitalis. Now all of you know herpes genitalis is a viral condition and it is caused by herpes simplex virus, that is HSV2. So HSV1 generally causes herpes labialis and HSV2 is the common causative organism for herpes genitalis. Now herpes genitalis और chancroid दोनों में ही painful ulcers होते हैं और दोनों में ही painful lymphadenopathy होती है. तो कई बार अगर आपको ये दोनों चीजें मिल जाएं तब भी आप कंफ्यूज हो सकते हैं कि भाई ये chancroid है या फिर herpes है. So there is one very important differentiating feature कि herpes में ग्रुप्ड वेसिकल्स मिलते हैं. सो हियर यू विल फाइंड ग्रुप्ड वेसिकल्स. तो मान लीजिए ये एक वेसिकल है, ये दूसरा वेसिकल है, तो कई सारे आपको इस तरीके से ग्रुप्ड वेसिकल्स मिलेंगे. नाउ व्हेन दीज वेसिकल्स So if vesicles are mentioned or painful vesicles are mentioned, then it is probably talking about herpes. लेकिन जब शेंक्रोइड की बात होती है और जब आप इसका जेनाइटल अल्सर देखेंगे, अभी हम इमेजेस में भी इनके जेनाइटल अल्सर्स दिखाएंगे आपको. So when you will see the genital ulcer of chancroid, there you will find undermined edges, which is very characteristic of genital ulcer of chancroid. So you should look for these important clues in the question. कई बार undermined edges लिखा होता है, कई बार grouped vesicles लिखा होता है. तो अगर vesicles हैं तो herpes होगा. अब एक और चीज होती है कि कई बार ये वेसिकल्स रप्चर हो जाते हैं बिकॉज दे आर प्रेजेंट ओवर जेनाइटल एरियाज ड्यू टू फ्रिक्शन इट माइट रप्चर. तो जब ये वेसिकल्स रप्चर होते हैं तो वहां पर इरोजन्स बन जाते हैं और इन इरोजन्स की साइक्लिक मार्जिन्स होती हैं. सो समटाइम्स दे माइट आस्क यू दैट पॉलीसाइक्लिक इरोजन्स आर सीन इन. सो पॉलीसाइक्लिक इरोजन्स आर फीचर ऑफ herpes genitalis. So these are some important clues to differentiate. I will request sir to tell few more points about herpes.
As sir have told that the lesions below the belt, that is below our waist, they are being done by HSV2, or above that is being done by HSV1. So that is very clear also. But that is not a rule. HSV1 can also cause this, and HSV2 can also cause the CNS infections. That is also there. And but generally what is seen, as sir have told, HSV2 does this herpes genitalis. Okay. Another thing which they can integrate up as per us is that they can give up a picture, or they can give up a history of this particular one, as sir have told up with the vesicles and all that, painful and all. And then they can ask up that this particular herpes is which sort of a virus. Is it single stranded DNA? Is it double stranded DNA? Okay. And is it single stranded RNA, or is it a double stranded RNA virus? And along with that, they can definitely put up, is it enveloped or non-enveloped? So these types of questions definitely will be asked in the integrated fashion, because they want to integrate up the subjects. So they want to know that you have this knowledge or not. So remember guys, for that you need to know something like mostly DNA viruses are what? Double stranded. So herpes is a DNA virus, so it's a double stranded one. And along with that, these all options will go off. Single stranded DNA is only one, that is parvo B19. That is, this is single stranded. Otherwise, every DNA virus is what? Mostly double stranded. So this is sorted. And regarding the envelope and all, you have 2-3 mnemonics for that. And that will go in a detailed one. But still, from that, you can get up like for the non-enveloped DNA viruses, we have a mnemonic PAP. That is parvo adeno papova. So those particular fellows are what? They are non-enveloped. So this is not coming in that. So it will be what? Envelope. So like this, you have to find out these particular questions. Already they are coming, sir. Like they have asked up regarding the erythema infectiosum, and after that they have asked down single stranded DNA, envelope, double stranded DNA, non-envelope, like that. So you need to know this. Then only you will able to do these types of questions. Fine. So
definitely. Now there might be a possibility that pain is absent in the genital ulcer. तो अगर आपके एग्जाम में क्वेश्चन आता है और उसमें लिखा है painless genital ulcer, then these can be 3 important conditions which can cause painless genital ulcers, that is syphilis, LGV and donovanosis. Now all these 3 conditions can present with painless genital ulcers, and once you have painless genital ulcers, then you should again look at the lymphadenopathy, whether it is painful or painless. So syphilis have painless lymphadenopathy, while LGV have painful, and in donovanosis the lymphadenopathy is absent. No lymph nodes are seen. Now this is very important because this is one among these conditions which does not present with inguinal lymphadenopathy. But sometimes these patients of donovanosis, they come to us and they have some swellings in the inguinal areas. तो इनके inguinal areas में कुछ swellings होती हैं, देखकर ऐसा लगता है जैसे lymph nodes हो, लेकिन lymph nodes नहीं होते. वो क्या होते हैं? वो false lymph nodes होते हैं. वो actually inflammation की वजह से nodules बन जाते हैं. तो उनको हम बोलते हैं false, that is pseudo-buboes. Yes. So buboes means lymph nodes and pseudo means false. तो ऐसी swellings जो lymph nodes जैसी दिख रही हैं लेकिन वो lymph nodes नहीं है. So this is again a very important question, that pseudo buboes are seen in, or no lymphadenopathy is seen in. It is donovanosis. Now syphilis presents with painless genital ulcer and painless, that is non-tender lymphadenopathy. Now if you look at this genital ulcer, it is generally single and इट इज वेरी हार्ड टू टच. इतना हार्ड होता है कि जब आप उसको पैल्पेट करते हैं तो ऐसा लगता है जैसे शर्ट का बटन रखा हो स्किन के नीचे. सो बटन लाइक इंड्यूरेशन इज सीन. हार्ड जेनाइटल अल्सर इज सीन इन सिफिलिस, while multiple, so here single, while multiple genital ulcers are seen in chancroid with undermined edges. So if hard word is written, that is suggestive of syphilis. And all of you know that syphilis is caused by which bacteria? Sir will tell more about it.
So guys, you already know that syphilis is done by what? Treponema pallidum. Okay. And Treponema pallidum is what? This is a spirochete. Okay. This is what? This is a spirochete, and this syphilis is a STD that everybody knows. Fine. We are studying up genital ulcer disease. And this particular spirochete, that is Treponema pallidum, the favorite question examiner is what? Can we culture it somewhere? So we can't culture it. Okay. So it is mostly what? Non-cultured, and it does not follow which uncle's postulate? Koch uncle's postulate. Okay, it's a famous scientist, Robert Koch, have told us that if you need to tell that this is a bacteria, so that have to grow in a pure culture media, otherwise it is not being considered as a bacteria. But this does not grow. Okay, but recently we have tried it to grow up in a media that is termed as Noguchi media, in which we able to grow up Treponema pallidum. Okay, so this might be asked up in the like INI-CET and all, that what is the recent update in this, that which media we can try up to grow up Treponema pallidum. So answer is Noguchi media. And recently, sir, in AIMS, they have asked up regarding the incubation period also. So that is like I used to tell like this, 9 to 90 days. It's around 10 to 90. 9 to 90 days is the incubation period of it. And it keeps on asking regarding these all diseases, these incubation periods also. So you need to focus upon this incubation period also on this. Okay. And besides that, one of the questions which is coming regularly, sir, ki for these spirochetes, which microscopy you will do? So that is dark ground microscopy. Okay, yes. So that is dark ground microscopy that is being done. And in this, what is the meaning of dark ground? Dark ground is like background is dark. Against this, these particular ones, they shine off. Okay, so basically, this is also one of the questions: in which type of light you use in this, reflected light or transmitted light? So basically, we use a reflected light. And we can imagine of this situation like that. Suppose you are sitting in a dark room, okay, and from a one window, the light is coming. So what you feel in that particular light, you start seeing particles, na?
Yes.
So that particular thing sort is there. The background is fully what? Dark, against which these spirochetes, they shine off. Okay, this is dark ground microscope.
And they have a very special movement also, no?
They have a corkscrew motility.
Yes.
Okay.
So that
motility is
motility
also you can definitely identify under the microscope, you know. And other than that, sir, we will discuss later the lab diagnosis and all.
Sure.
Because those are there, na? Like non-treponemal and treponemal test.
Okay. Now, another differential for painless genital ulcer with painful inguinal lymphadenopathy is LGV. Now, LGV, that is lymphogranuloma venerum, this is a condition where you will find transient genital ulcer. Transient. So, genital ulcers are transient. Now, transient means for a very short duration. Okay. So, genital ulcer हुआ और कुछ ही दिनों में ठीक हो गया. तो अगर किसी पेशेंट को genital ulcer हुआ और कुछ ही दिनों में ठीक हो गया, तो वो कई बार सोचता है कि मैं डॉक्टर के पास क्यों जाऊं, हो सकता है कुछ छोटी मोटी चीज हुई और ये ठीक हो गई. So the late complications of LGV become very important because many a times these patients do not present with genital ulcers. So this was one of the questions, that which of the following STI do not present with genital ulcer. So we know that genital ulcers are seen in each and every STI, but actually because these are transient, so the patient do not present with genital ulcers in LGV. So the answer was LGV. Now, because they do not present with genital ulcers, they present with late complications. And one of the late complications is groove sign. So they ask you, groove sign is seen in. So groove sign is seen in LGV. What is groove sign? तो मान लीजिए ये inguinal ligament है. तो inguinal ligament के दोनों तरफ lymph nodes enlarge हो जाती हैं. So because there is lymphadenopathy, the lymph nodes enlarge on either side of the inguinal ligament, leaving a groove in between. So a groove is very characteristically seen in this condition. So that is known as groove sign. Sir, you would like to add up about the causative organism?
So lymphogranuloma venerum, mostly like students, they are confused up. It is done by what? So LGV is done by Chlamydia trachomatis. Okay. It is being done by Chlamydia trachomatis. Which particular strains of it? L1, L2, L3. Okay. L1, L2, L3. And in that also, L2 does more than the L1. So I have asked a number of times the students that do they know that who does LGV? Mostly they are confused. Okay. So Chlamydia trachomatis, L1, L2, L3 strains, they does this LGV. And one of the recent questions is regarding the incubation period, which varies up between 3 to 30 days, and it can go up to 42 days also. So you can remember this particular one also. Okay, sir, I used to tell our mnemonic also in that. I don't know you also tell or not, but this particular one helps to remember the various aspects of it. So as you have told that it becomes transient once. So mostly it remains what? Asymptomatic. Okay. Other than that, this also have these particular swellings, that is boo-boos. Okay. C is, which we tend to forget again and again, the causative organism of it, that is Chlamydia trachomatis. D is
drug
your
of
drug.
choice.
What is
Doxy.
that, sir? That is doxycycline. Fine. E is isthiomin. Okay. And this is actually what, sir?
This is again a late complication. Actually, what happens that in LGV, that is lymphogranuloma venerum, there is lymphatic obstruction which occurs, and due to lymphatic obstruction, there is the enlargement of the genital. So in female patient, what happens? There is vulval elephantiasis.
Okay.
That is the size of vulva increases, and that is known as esthiomin.
Okay. Can it happen in the rectal region also, or it's
Yes,
a vulval only?
yes. Generally, it happens in the vulval area,
Okay.
and it can happen in rectal. It can happen in males also. So in males, when genital elephantiasis occurs, there is penile elephantiasis.
Okay.
So जब penis का size increase होता है, so you will find that penis starts appearing something like this, like a saxophone. So this is again another complication, like groove sign, esthiomin, and saxophone penis.
So there's a complication.
These are all late complications when the patient presents late.
And we do this particular test, Fry's test, which is a skin test, and this is type 4 hypersensitivity. Most of the tests are type 4 hypersensitivity only of skin ones. And G, as sir have told already, that is a groove sign. Okay, so you can remember one of the features by this: A, B, C, D, E, F, G. Okay,
So very nice mnemonic for all of you. So with this freeze test, there was one more test which was sometimes they ask, that is ITO test. So both these are very obsolete tests, not very frequently done nowadays. So they ask you freeze test is done for, so answer becomes LGV. But if they ask you ITO test is done for, then the answer is chancroid. So this was done in past. This is obsolete now. No longer we use it. But this was intradermal test.
Sometimes the traditional ones they ask.
Yes.
Like ITO is done for, Fry's is done for.
So another differential for painless genital ulcer with no lymphadenopathy, that is absent inguinal lymph nodes, is donovenosis. Now donovenosis, when you will see the patient of donovenosis, you will generally find a single painless genital ulcer with beefy red, very red. And why it is red? Due to a lot of granulation tissue there. So it is a granulomatous.
It is also termed a granuloma inguinale also, no, sir?
Yes, another name is granuloma inguinale. Yes, and recently the question was also asked that the causative organism for granuloma inguinale is, and many students got confused that they are talking about which disease. So that is donovenosis, and the causative organism here, sir will tell you more about it. So beefy red granulomatous genital ulcer is seen in this condition, and this genital ulcer is so granulomatous, it is so red that even if you touch it, it is going to bleed. So it bleeds very easily on touch. So it easily bleeds. So this is a very important characteristic of this genital ulcer. So as we have discussed all these 5 conditions, so remember that first differential is that you should look for pain. एक बार आपको पेन मिल गया तो या तो शैंक्रोइड या फिर हर्पीज है. अगर ये दोनों दिख गए, अगर दोनों में ही पेन हो रहा है, तो फिर आप ये देखिए कि वेसिकल्स हैं या फिर अंडरमाइंड एजेस हैं. अगर अंडरमाइंड एजेस है तो शैंक्रोइड है, और अगर आपको वेसिकल्स मिल गए तो जेनाइटल्स हैं. अगर पेनलेस जेनाइटल अल्सर है तो आप लिम्फ नोड्स देखिए. अगर लिम्फ नोड्स पेनलेस है तो सिफिलिस है. अगर लिम्फ नोड पेनफुल है तो एलजीवी है. और अगर लिम्फ नोड्स हैं ही नहीं तो डोनोवेनोसिस है. अगर फिर भी आप कंफ्यूज होते हैं, देन यू शुड लुक फॉर दीज इंपॉर्टेंट क्लूज लाइक हार्ड जेनाइटल अल्सर इन सिफिलिस, transient genital ulcers or late complications in LGV, and beefy red granulomatous base which bleeds very easily on touch in cases of donovenosis, which is caused by Clematobacterium, which is an old name now known as Klebsiella granulomatous. Sir will tell you more about this.
And as sir have told up, donovenosis, this particular one is being done by this organism Klebsiella granulomatous, and previously it was known as Calamity granulomatous. And obviously because of this granuloma formation only this name have come. And Klebsiella, this is a gram-negative bacillus. Okay, this is a gram-negative bacillus, member of Enterobacteriaceae family. Important regarding this particular one they are non-motile organisms. So they can relate up this property also in the question that Klebsiella is motile or non-motile. So this is non-motile. And other than that, sir, in this we got to see certain bodies, and those particular ones they are termed as what Donovan bodies. And if you want to tell us something about them, then you please. The
Donovan bodies, as you all know, they are seen in donovenosis. And donovenosis, what happens that these macrophages, they engulf this bacteria. And this bacteria also have this bipolar staining. They also have this safety pin appearance. So when you find these bipolar stained bacteria inside these macrophages, we call them Donovan bodies.
And the students, they often confuse it with the Leishman Donovan. And Leishman Donovan is an entirely different thing. They are termed as LD bodies. And these are the amastigote forms. Okay, these are what? These are the amastigote forms, and these amastigote forms, they are observed in the splenic biopsy and the bone marrow biopsy. And this was also one of the asked question in which they have written up that a special structure near this LD body's nucleus we see, that is the kinetoplast. So if they are talking about this kinetoplast and all, immediately you should think for LD bodies, and LD bodies is seen in, as the name suggests, Leishman Donovan, Leishmaniasis, visceral Leishmaniasis, that is Kala Azar, and that is there in our India also, that is in the Bihar. Fine. So these all important points you need to know, because students, they tend to confuse. The Donovan bodies is same as Leishman Donovan. No, Leishman Donovan is Leishmaniasis, that is Kala Azar, and Donovan bodies are seen in what? Donovenosis. Fine. So I think with this particular chart, sir and me have beautifully told up that how to approach of a genital ulcer disease, and this is the best way to tell. And along with that, we have done the possible integration also of the questions which can be asked from the microbiology point of view. And with the diagrams also, I can add upon that certain test and all which we like to tell to you. Okay, so let's move forward, sir.
Sure.
We already done.
So let us see a few images here. Like here you can see that this patient presented with this painless genital ulcer, which was single. So single painless genital ulcer. And if you palpate this genital ulcer, it is having very hard, that is very firm induration. So such is the characteristic of syphilitic genital ulcer. And syphilitic genital ulcer is seen in primary syphilis. Okay, so the first syphilis, that is after the incubation period when the first symptom appears, that is the primary syphilis. So primary syphilis presents with genital ulcers, and these are the characteristics of these genital ulcers. Commonly the site is near frenulum, like you can see in this image. So these are the syphilitic genital ulcers.
So actually in the class I used to tell that syphilis is a favorite of examiner. Okay, and like that you must be agreeing up, they must be asking a lot of questions which repeat again and again. Like nowadays they are asking chromoblastomycosis and all. So I had to joke up, that particular examiner must have suffered from that disease. So syphilis is also a favorite of examiner. Okay, so is it common nowadays also, sir? Syphilis? Do you see up in the OPDs?
Yeah, sure. We see syphilis, but this is not very common. Once in a while, we can see these. We find these patients. Like recently, I had a patient in my clinic, and he was suffering from syphilis. And in fact, he was a patient of secondary syphilis. So genital ulcers were not very prominent, but yes, secondary syphilis features were there. Like condyloma lata was there. Those presentations like the pigmented lesions which are seen over palm and sole, where we elicit the Buschke-Ollendorff sign, which we'll be discussing in a while. So all these were the positive findings which were there, and then we did the test, and VDRL came out positive, and then TPHA was also positive, and then finally we started with the treatment.
So like how you we say that VDRL is done to assess the prognosis of the syphilis. So will you be going for a repeat VDRL also?
Yes, definitely. So after once we give the treatment, we go for repeat to check whether the titer is reducing or not.
Fine.
Now, as you all know that genital ulcers are the common presentation, but sometimes patient can present with oral ulcers as well. And this is one very important feature which is seen in secondary syphilis, that is condyloma lata. कई बार स्टूडेंट्स कंफ्यूज हो जाते हैं condyloma acuminata से. So condyloma acuminata,
that is HPV1.
Yes, it is the term which is used for
genital warts.
Yes, anogenital warts. So anogenital warts which are caused by human papilloma virus 6 and 11. So these are the common human papilloma virus which causes condyloma acuminata. अब आप इसके नाम से ही आइडेंटिफाई कर सकते हैं. एक है acuminata और दूसरा है लाटा. ठीक है. acuminata का मतलब होता है पॉइंटेड, और लाटा का मतलब होता है स्लाइटली फ्लैट। ओके, तो अगर आपको लीशंस का बहुत रफ सरफेस दिख रहा है, पॉइंटेड आउटग्रोथ्स हैं, देन इट इज प्रोबेबली वॉट। सो वायरल वॉट्स आर जनरली रफ सरफेस, इसीलिए उसका नाम होता है वेरुका। वेरुका मतलब होता है रफ सरफेस, वेरुकस। एंड ये होते हैं लाटा, लाटा मतलब फ्लैट। सो दीज आर स्लाइटली फ्लैट।
ग्रीक ऐसे रही है, दिस इज ग्रीक लैंग्वेज
probably. So but both can be seen in the genital areas. Okay, so if you ever get confused you can closely examine. आप हैंड लेंस ले लीजिए, पास से देखिए, अगर आपको स्मूथ दिख रहा है तो वो लाटा है, और अगर आपको रफ दिख रहा है तो वो एक्यूमिनाटा है. So these are very highly infectious lesions of secondary syphilis. They are seen in wet areas like groin and genital areas.
Do we call them as condylomata lata also? So is it that way also? Because I have seen like some they write up like this condylomata lata. So fine. What is the meaning of condyloma actually?
सर कॉन्डाइलोमा, अगर हम ग्रीक वर्ड इसका देखें, मीनिंग देखें, तो उसका मतलब होता है नकल्स, और अगर हम अपनी नकल्स देखें तो वो थोड़ी सी उभरी हुई हैं. सो दीज आर एक्चुअली द ग्रोथ्स. सो दोनों में ही ग्रोथ है, लेकिन अगर ग्रोथ वो पॉइंटेड है तो आप बोल सकते हैं वॉट्स, और अगर वो फ्लैट सरफेस्ड है, स्मूथ है, तो आप बोल सकते हैं लाटा, विच आर सीन इन सेकेंडरी सिफिलिस. नाउ समटाइम्स पेशेंट डेवलप्स टर्शियरी सिफिलिस. सो if the patient is not taking treatment and it progresses to tertiary syphilis, then gummatous lesions are seen. These gummas are characterized by punched out edges with their base is very characteristic. So जब आप lesions देखेंगे, जैसे आप यहाँ पर इस इमेज में देख पा रहे हैं, ऐसा लग रहा है जैसे कि स्किन को punched out कर दिया है, निकाल दिया है. So punched out edges are there with washed leather base. तो जब हम लेदर को बहुत देर तक पानी में रखते हैं तो वो उसमें सिल्वटें सी पड़ जाती हैं, तो उसी तरीके का बेस दिखता है, वॉश्ड लेदर बेस. सो दिस इज वेरी कैरेक्टरिस्टिक ऑफ गम्मेटस लीशंस व्हिच आर सीन इन टर्शियरी सिफिलिस. Okay, so many a times they ask that what are the common presentations of these different types of syphilis. तो याद रखिए कि अगर प्राइमरी सिफिलिस है तो पेशेंट जेनाइटल अल्सर की तरह प्रेजेंट करेगा. अगर सेकेंडरी सिफिलिस है तो जनरली रैशेस की तरह प्रेजेंट करता है. वो रैशेस कहीं पर भी हो सकते हैं बॉडी में, तो क्योंकि वो स्केली रैशेस होते हैं तो दे माइट मिमिक pityriasis, rosea or psoriasis, and sometimes these are pigmented rashes over palm and sole. When you press them, they are tender to touch. This is known as Buschke Ollendorff sign, and they might also present with genital lesions in the form of condyloma lata. और फिर आती है latent syphilis, जिसमें symptoms नहीं होते, लेकिन केवल अगर आप सीरोलॉजी करते हैं तो वो पॉजिटिव आ जाती है. एंड फिर आती है टर्शियरी सिफिलिस, वेयर यू कैन हैव सीएनएस इन्वॉल्वमेंट, दैट इज न्यूरोसिफिलिस, सीवीएस इन्वॉल्वमेंट, दैट इज कार्डियोवैस्कुलर aortic regurgitation or aortic aneurysm, and gummatous lesions over the skin. During any of these phases of syphilis, अगर कोई प्रेग्नेंट पेशेंट बर्थ देती है किसी बच्चे को, तो उस बच्चे को चांसेस होते हैं कंजेनाइटल सिफिलिस होने के. और इसको भी हमने दो में डिवाइड किया है. अगर बच्चा जल्दी प्रेजेंट कर देता है विद इन 2 years तो हम उसको बोलते हैं अर्ली कंजेनाइटल, और अगर लेट प्रेजेंट करता है तो उसको हम बोलते हैं आफ्टर 2 years वी कॉल इट लेट कंजेनाइटल सिफिलिस. सो अर्ली एंड लेट कंजेनाइटल सिफिलिस डिपेंडिंग ऑन द ड्यूरेशन, दैट इज 2 years. सो कई बार लेट कंजेनाइटल सिफिलिस में when patient presents late, then you will get such type of upper central incisors having a notch. Such type of teeth are known as Hutchinson teeth, and these are included in a triad, that is Hutchinson triad. हचिनसन ट्रायड याद करने का मैं हमेशा बच्चों को एक तरीका बताता हूं कि आप गांधी जी के 3 बंदरों को याद कर लीजिए. गांधी जी के 3 बंदर थे. बुरा मत देखो, तो ये बच्चे बुरा नहीं देख पाते. क्यों? क्योंकि इनकी आंखें खराब हैं. दे हैव इंटरस्टिशियल केरेटाइटिस. ओके. बुरा मत सुनो, तो ये लोग बुरा नहीं सुनते. क्यों? क्योंकि कान खराब है. दे आर डेफ. सेंसरी न्यूरल हियरिंग लॉस. एंड बुरा मत बोलो, ये बुरा नहीं बोलते. क्यों? क्योंकि दांत खराब है. Hutchinson teeth. So there are 3 findings related to eye, related to ear, and related to mouth. So you can easily remember Hutchinson triad, which is seen in late congenital syphilis. लेकिन अगर patient early present करता है, so early congenital syphilis generally presents with nasal snuffles. Rhinitis की तरह present करता है. Nasal snuffles we call it. So snuffles are seen in early congenital syphilis. So sir, please elaborate on some investigations which can be done.
So for the lab diagnosis of syphilis, obviously we go for what? Non-treponemal and treponemal testing. So non-treponemal test, as everybody knows, they are of 2 types. One is VDRL and one is RPR. Okay. And we say that which one is better? We tend to have RPR better. Why? Because this is a card test. Okay, and what is RPR? Rapid plasma reagent. It's a CAR test, whereas a VDRL is a slide flocculation test, and we need a proper microscope to see this. And obviously, microscope arrangement and all that, they takes time, and we have to prepare a liquid for this. If we don't use that liquid one day, 24 hours, it will be going waste. So obviously, that is not practically feasible. Also, economically, it's not viable. So we tend to go for what? This particular RPR, that is a CAR test, which tends to show up same equal efficacy results as of VDRL. Okay, but obviously our fluid is not going waste and all that, because how many tests they come, according to that you can put the cards. So it is economically viable also. Another important thing regarding this particular stuff is that RPR is a good test, no doubt, but in the sample of neurosyphilis, CSF, this particular one fails. Okay, RPR fails. For that, we have to go for what? VDRL CSF. So this is tend to be the investigation of choice for neurosyphilis. And it was asked in AIMS exam, that INI-CET exam, that what is the investigation choice for neurosyphilis? That is VDRL CSF. Okay, so for that you need to go for this. And the other options which are there in that word of the triple ones, like FTA-ABS and all that, even it is better than FTA-ABS, which are triple tests, which are more sensitive and specific. But here you need to remember this, that investigation of choice for neurosyphilis as per the data also is VDRL CSF. Okay, so this is one of the important points. Another is that which all triple tests we have practically, or for the knowledge of the MCQs and all. So most sensitive, what they tell is, the most sensitive is FTA-ABS. Okay, fluorescent triple antibody assay. Okay, and the most specific as per the book is TPI, that is treponema pallidum immobilization assay. And in this immobilization assay, we tend to use what? Live troponins. Okay, we tend to use what? Live troponins, and that is a problem for the person who is doing this test. Okay, so that's why we avoid the TPI, and rather than we can go for TPPA, that is treponema pallidum particulate agglutination assay, and the actual test which is being done in the labs is TPHA. Okay, that is treponema pallidum heme agglutination assay. Okay, so this is practically done, and I suppose you will also agree with me that this is a test which is commonly being done by the labs, TPHA for this, and TPPA is there, you can do, and TPI is not done nowadays because it involves what? Usage of live troponins. And regarding the sensitiveness, the most sensitive is this fluorescent triple antibody assay. And one more question which comes up is that regarding the congenital syphilis, which particular test you will prefer to go up? Is it IgM FTA-ABS or IgG? So answer to this question is, guys, IgM FTA-ABS. Okay, IgM FTA-ABS. Why? Because this is the antibody which is produced up in any of the acute infection. If the child is having it, newborn is having it, it will produce what? IgM. So you have to detect this rather than the IgG. IgG might have come from the mother. Okay. So congenital syphilis investigation of choice will be this. That is IgM FTA-ABS. So you want to add something?
Sure. So, like, if they ask you primary syphilis, what should be the investigation of choice? Because there is only genital ulcer. What we do, we take the smear and we go for dark ground microscopy.
Fine.
So that becomes a very good investigation there. And sometimes they ask you that what is the bedside investigation. So obviously these are the lab tests. Okay. So read what the examiner is asking. If the examiner is asking about the blood test or the lab test, then you should mark this. But if it is written that bedside investigation, then obviously that has to be done bedside in the ward. And in the ward, what you can do, you can take the smear and you can do the dark ground microscopy. So read it. If they are asking about bedside, then you can go for dark ground microscopy, especially in primary syphilis. And if you want to go for the lab investigation, all these lab investigations are possible, which are...
I think that type of question came also.
Yes.
Like in a village where you don't have these facilities, what you will go for. So that was dark ground microscopy.
Yes. So sometimes this is very tricky. Students को लगता है कि FTA-ABS तो बड़ा ही sensitive test है, हम ये करेंगे. But लेकिन वो question को पढ़ना भूल जाते हैं कि वहाँ पे bedside लिखा हुआ है. So bedside आप कैसे करोगे? So you should mark dark ground microscopy in those questions.
And here, like as we have discussed, for prognosis syphilis, we'll go for VDRL.
Yes.
That will be the best test to assess that. Okay.
Now coming to the chancroid, I already told you that chancroid presents with painful genital ulcers. These are generally multiple. So multiple painful with undermined edges. ओके, सो विद अंडरमाइंड एजेस. कई बार मैं स्टूडेंट्स को ये डायग्राम दिखाता हूँ और पूछता हूँ कि भैया ये अल्सर है अगर, तो इसकी एज कौन सी है, और ज्यादातर स्टूडेंट्स मेरे को बोलते हैं कि सर अल्सर की एज तो ये लग रही है क्योंकि यहीं से अल्सर शुरू हो रहा है. तो याद रखिए कि दिस इज नॉट द एज ऑफ द अल्सर, दिस इज द मार्जिन ऑफ द अल्सर एंड दिस पोर्शन इज द एज ऑफ द अल्सर. सो अंडरमाइंड एजेस का मतलब क्या होता है? अंडरमाइंड एजेस का ये मतलब होता है, आपने अगर सर्जरी की पोस्टिंग की होगी तो आपने ओटी में देखा होगा कि जब कोई एक्सीजन होता है तो उसके बाद स्किन को अप्रोक्सीमेट करने के लिए कई बार अंडरमाइनिंग की जाती है, क्योंकि वहां पर एरिया खत्म हो गया, उसको स्ट्रेच करके पास में लाना है, अप्रोक्सीमेट करना है, तो स्किन के नीचे अंडरमाइनिंग करते हैं सो दैट स्किन कैन कम नियर एंड इट कैन बी सूचर्ड. ओके, सो दैट इज अंडरमाइनिंग, दैट इज एजेस यहां से नहीं होंगी या गायब होंगी. ठीक है, देयर इज अंडरमाइनिंग हियर on both the sides. So such type of genital ulcers are there. So if you closely see, you will find that there is some gap or some space beneath the skin in the edges. So that is undermined edges which is seen here. So as you can see, multiple painful genital ulcers with अंडरमाइंड एजेस. एज यू कैन सी हियर कि एजेस ऐसी लग रही हैं कि हैंग कर रही हूँ ऊपर से, नीचे से अंडरमाइंड है वो. ओके, सो दिस इज अ वेरी कैरेक्टरिस्टिक जेनाइटल अल्सर व्हिच इज सीन इन शैंक्रोइड. दिस इज नोन एज अंडरमाइंड एजेस. ओके, अब कई बार क्वेश्चन आता है कि अंडरमाइंड एजेस आर सीन इन, एंड आप ढूंढ रहे होते हो शैंक्रोइड, और शैंक्रोइड ऑप्शन में होता नहीं है. तो याद रखिए कि दिस इज नॉट द ओनली कंडीशन वेयर अंडरमाइंड एजेस आर सीन. सो अल्सर विथ अंडरमाइंड एजेस are not only seen in chancroid, but they can also be seen in tuberculosis and one rare condition, that is pyoderma gangrenosum.
I think this pseudomonas does it. That is
वो दूसरा है सर. एक्चुअली दिस पायोडर्मा गैंग्रीनोसम में पायोडर्मा वर्ड है ना, और पायो का मतलब होता है पस, तो लोगों को लगता है कि दिस इज इन्फेक्टिव कंडीशन एंड मेनी स्टूडेंट्स गेट कंफ्यूज. सो रिमेंबर दैट दिस इज नॉट इन्फेक्टिव कंडीशन एंड दिस इज जनरली एसोसिएटेड विद इन्फ्लेमेटरी बाउल डिजीज एंड हियर इन द ट्रीटमेंट वी डोंट गिव एंटीबायोटिक्स, इंस्टेड द ड्रग ऑफ चॉइस इज स्टीरॉइड्स. और जो स्यूडोमोनास की वजह से होता है वो होता है एक्थाइमा पायोजेनिकम.
एक्थाइमा गैंग्रीनोसम आई टेल.
Ecthyma gangrenosum. Yes, correct, sir. So ecthyma pyogenicum is caused by strepto and staph, and ecthyma gangrenosum is caused by pseudomonas.
Right.
So अगर लिखा है पायोडर्मा गैंग्रीनोसम तो ये नॉन इन्फेक्टिव है, लेकिन अगर लिखा है एक्थाइमा गैंग्रीनोसम तो वो इन्फेक्टिव है, एंड दैट इज कॉज्ड बाय स्यूडोमोनास.
राइट, तो ये पूछ सकते हैं 100%.
हाँ,
डेफिनेटली.
तो ये इसके ऊपर क्वेश्चन आता है. एक बार एक्थाइमा कंटेजियोसम के ऊपर भी क्वेश्चन आया था, एक्थाइमा कंटेजियोसम, और इसके ऊपर क्वेश्चन इसलिए आता है क्योंकि ये बैक्टीरिया से नहीं होता, दिस इज अ वायरल कंडीशन. ओके, सो कई बार कंफ्यूज हो जाते हैं. यहाँ पर एक्थाइमा हमें लगता है बैक्टीरियल है, और एक्थाइमा जनरली बैक्टीरियल होता है जैसे कि पायोजेनिकम या गैंग्रीनोसम, लेकिन कंटेजियोसम इज वायरल.
जैसे molluscum contagion. Okay, and here if I want to add up one thing, like when we go for the biopsy and we do the Giemsa stain and all, we could able to observe this type of appearance of it, that is termed as school of fish appearance. Okay, school of fish, or we tend to call it as tram track appearance. So these particular bacteria, they arrange themselves like parallel tracks. So that is termed as school of fish or tram track appearance. Another one which I already told up, that we love to grow it on chocolate agar, and we have to add up from our side a factor X to stimulate the growth of Haemophilus ducreyi. Okay.
So herpes, as I told you, they present with multiple painful vesicles. Okay, so vesicles are generally seen. That is, fluid-filled lesions are seen, but because they are present over genital areas, due to friction, they might rupture and patient may have erosions. So जरूरी नहीं है हर बार आपको fluid-filled lesions, vesicles मिलेंगे, कई बार आपको erosions मिल जाते हैं, और कई बार अगर ये इकट्ठे होते हैं, grouped होते हैं, तो वो polycyclic भी हो सकते हैं, कुछ इस तरीके के. So there can be erosions as well. So अगर आपको painful erosions मिल रहे हैं, then also you should think of herpes simplex infection, that is herpes genitalis. Okay. Now in herpes genitalis, the drug of choice is acyclovir. So acyclovir is generally the drug which is given for herpes infection. Now sometimes students get confused कि acyclovir हम किस डोज में देंगे, 200 mg की डोज में देंगे या फिर 800 mg की डोज में देंगे. तो याद रखिए कि जब herpes सिंप्लेक्स वायरस का इन्फेक्शन होता है, चाहे वो हर्पीज सिंप्लेक्स वायरस 1 हो या फिर 2 हो, मतलब कि या तो लेबियालिस हो या फिर जेनाइटलिस हो, आप 200 mg देंगे. दिस इज गिवन 5 times a day फॉर 7 days. लेकिन जब वेरिसिला जोस्टर वायरस का इन्फेक्शन होता है, so varicella zoster virus which causes chicken pox and reactivation of the varicella zoster virus causes herpes zoster shingles. So जब herpes zoster होता है then we use higher dose. Okay, and this is very easy to remember. देखिए simple virus है, simplex है, simple virus है, simple dose है 200. यहाँ पर zoster virus है, बड़ा virus है, तो बड़ी dose.
नंबर में भी बड़ा है 3.
Correct. So this is 5 times a day. So we give both these 5 times a day for 7 days, but the doses are different. Simple virus, simple dose. Zoster virus, big dose.
Zoster, another name is HHV3. So human herpes virus 3. So in number also it's big.
Yes.
So it will be more. And sir, this also is there now. They tend to ask regarding Zank smear nowadays.
Yes.
HSV1, HSV2 and HHV3. For all of them, these alpha Vindi members are there, or the herpes family. And for all of them, you can go for what? Zank smear. And otherwise, for all the viral infections, we have in common what? PCR and ELISA. And now PCR and ELISA is available for every possible virus you can think of. Right? So PCR and ELISA, only thing you have to write up for the microbiologist to tell us that for what you want. HSV1, HSV2 or HHV3 what. Then they will put the particular probes of that only. Right? So like that. Anything more, sir? Yeah.
Yes. So Zank smear, many a times question have been asked. So they ask you that blister है, vesicle है, तो आप कैसे differentiate करेंगे कि pemphigus का है या फिर herpes का है, है ना? So if you want to differentiate basis of Zank smear, so if you are preparing Zank smear and if you find multi-nucleated giant cells, then it is suggestive of herpes. But if you are examining the Zank smear and if you find acanthocytes are nothing. These are the keratinocytes which have separated from all the sides. So this is seen in pemphigus. क्योंकि pemphigus में क्या होता है कि डेस्मोग्लिन का डिफेक्ट होता है, डेस्मोसोम्स ब्रेक होने लगते हैं, केरेटिनोसाइट चारों तरफ से सेपरेट होने लगती हैं. तो आपको ऐसी केरेटिनोसाइट्स मिलेंगी विच हैव सेपरेटेड फ्रॉम ऑल द साइड्स, इनको हम बोलते हैं एक्यांथोसाइट्स. तो अगर आपको ऐसी केरेटिनोसाइट्स मिल रही हैं ज़ेंक स्मीयर बनाने पे तो प्रोबेबली पेम्फिगस है. लेकिन अगर आपको मल्टी न्यूक्लिएटेड जाइंट सेल्स मिल रहे हैं तो हर्पीज है. सो दिस इज वन इंपॉर्टेंट क्वेश्चन विच कैन बी आस्क्ड. This is again a case of herpes. As you can see, these multiple painful erosions are present. So these are seen in herpes infection. So I hope this session was useful for all of you. We have covered most of the STI infections and the differential diagnosis, how to approach to these questions. And if you go by this method, you can answer and solve most of these questions which are asked in various exams.
And I think that this particular topic is being asked again and again. Okay, so this is a very high yield topic, for no doubt for that. And this is the best way to read this. And if you do this type of integrated sessions and learn them properly, you will able to solve most of the questions from this particular area. And this is, I suppose, is next. And like that only the questions will be asked. And they are being asked now also. Okay, so this is the way to go up. And in the part 2, we'll cover up the other fungal infections and all. And definitely those topics are also very high yield and all. And we'll be covering up in the future sessions. Fine. So thank you so much from my side.
Thank you. All the very best.
And very best of luck.